The following medications may not have always been the worst medications for everyone. They may have been started because they were the best options at the time, and that may no longer be the case. Other times, your healthcare professional will choose a certain medication because it also treats another condition that you have. In that case, it may be the right choice for you. If you're taking any of these older blood pressure medications, check with your healthcare professional to find out whether it's time to make a change. Beta blockers. Usually, beta blockers aren't used as first-choice therapies to lower blood pressure. For most people, other blood pressure medications can do a better job of lowering blood pressure with fewer side effects. Common beta blockers include 1. Tenormin, atenolol. 2. Metoprolol, Toprol. 3. Propanolol, Indol. 4. Bisoprolol, Zebeta. Side effects of beta blockers may include 1. Dizziness. 2. Nausea. 3. Low blood sugar. 4. Shortness of breath and wheezing. 5. Fatigue. 6. Rash. 7. Erectile dysfunction. 8. Low heart rate. 9. High triglycerides. But there are certain scenarios where a beta blocker is the best choice. 1. A beta blocker might be added to another medication if your blood pressure isn't controlled on a single medication. 2. If you have heart rhythm problems like atrial fibrillation, you might benefit from a beta blocker. 3. If you have coronary artery disease, CAD, or heart failure, beta blockers may help to protect your heart. 4. If you're pregnant, certain beta blockers may be the best choice. So taking a beta blocker can be the right thing for many people. But if you're only taking a beta blocker for high blood pressure, check in with your healthcare professional to be sure it's the best option for you. Loop diuretics. Furosemide, Lasix, is a type of diuretic, water pill, known as a loop diuretic. Loop diuretics are not considered first-choice medication for lowering blood pressure. But they're useful for getting rid of excess fluid in the legs and lungs if you have heart failure. Common loop diuretics include 1. Furosemide, Lasix. 2. Bumetanide, Bumex. 3. Torsemide, Demodex. Side effects of loop diuretics include 1. Frequent urination. 2. Dizziness. 3. Low potassium and magnesium. 4. Rash. 5. Dehydration. 6. Stomach upset. 7. Ringing in the ears. If you're on a loop diuretic, you'll need regular blood work to check your kidney function and electrolytes. On the other hand, thiazide diuretics, such as chlorthalidone and hydrochlorothiazide, are good options to treat high blood pressure. We'll cover those later in this article. Alpha blockers. Terazosin, Hytrin, and Prazosin, Minipress, are known as alpha blockers. They can be used to treat high blood pressure. But they also treat symptoms related to enlarged prostate, like difficulty urinating. The most important downside to alpha blockers is low blood pressure when standing. This is known as orthostatic hypotension. That can result in fainting episodes, especially if you get up to go to the bathroom in the middle of the night. This side effect is more likely to happen in the first few days after starting the medication. Alpha blockers can also cause 1. Dizziness. 2. Headache. 3. Drowsiness. If you're taking an alpha blocker for high blood pressure only, check in with your healthcare professional to find out if there's a better choice for you. Vasodilators. Hydralazine, apresiline, is in a class of medications known as arteriolar vasodilators. Compared with other medications used to treat high blood pressure, hydralazine has more side effects and isn't considered a first-choice option. Side effects of hydralazine can include 1. Headaches. 2. Dizziness. 3. Heart palpitations. 4. Stomach upset. 5. Diarrhea. 6. A condition that's similar to lupus, usually after several months of use. 7. Liver injury. In some cases, hydralazine can be added to other medications to control blood pressure. And it can be a good choice for people with heart failure, especially if they can't take other medications for the condition. But if you're taking hydralazine, you should get regular checkups to be sure you're not developing side effects. Alpha-2 agonists. Clonidine, Catapres, is in a class of medications called central alpha-2 agonists. Clonidine isn't a first-choice medication because it has many side effects. That includes rebound hypertension if it's stopped abruptly or if you skip doses. Clonidine pills usually have to be taken at least twice daily, so this can also be a problem. There's also a clonidine patch that you replace weekly. Other possible side effects of clonidine include 1. Drowsiness. 2. Dry mouth. 3. Slow heart rate. 4. Stomach upset. 5. Erectile dysfunction. 6. Depression. If you're taking clonidine for high blood pressure and haven't tried other medications, talk with your healthcare professional to see if there's a better option for you.